Hi everyone. Today in this video, let us discuss Cariprazine. What is this drug Cariprazine? This drug is classified as atypical antipsychotic. So this drug is used in the treatment of schizophrenia, where it can reduce the hallucinations, delusions. It can also reduce the negative symptoms such as social withdrawal, flattening of emotions, and being an atypical antipsychotic. This drug is not only useful in the treatment of psychosis, but it is also indicated for the management of bipolar mania. This is a depressive disorder where the mood swings from depression to mania. In such conditions, again, Cariprazine can control this bipolar mania. And particularly, this drug shows more affinity towards dopamine D3 receptors, which is unique in this category. So today in this video, we are going to see what is the chemical nature of this drug, how this drug acts, how it can reduce both positive as well as negative symptoms, what are the important precautions, side effects, and dosage. All these things we will discuss in this video. First of all, what is the chemical nature of this drug? So this is the structure of Cariprazine. Here we can simply identify the urea moiety. Let us give the numbering. Now to this urea, on the nitrogen methyl groups are present, so we can write the suffix as 1,1-dimethylurea. And on the other nitrogen, cyclohexyl ring is present, so we can write this as 3-cyclohexyl. Now to this cyclohexyl ring, at the fourth position, ethyl side chain is present, so 4-ethyl. Now to this ethyl chain, at the second carbon, piperazine ring is attached. Now this piperazine ring is attached by first position, so we can write this as 2-piperazine 1-yle. And finally, to this piperazine, at the fourth position, phenyl ring is attached with 2 chlorine groups at second and third position. So this group can be represented as 4-2,3-dichlorophenyl. That is the complete name of Cariprazine. Now let us see how this drug acts. Cariprazine can block many of the receptors. It can act as a partial agonist so that it can block the D2 receptors. It can also block D3 receptors, which is somewhat more important in its effectivity towards both psychosis as well as mania. And it can also block 5-HT2 receptors as well as 5-HT1A receptors. Apart from these receptors, it can also block H1 receptors, cholinergic receptors, and adrenergic receptors. But its main antipsychotic action and anti-manic action is mainly related with action on D3 receptors as well as D2 receptors. So at the mesocortical pathway, dopaminergic neurons are present, which are equipped with dopamine. On the postsynaptic neurons, dopamine receptors are equipped. Here D3 receptors are one type of dopamine receptors which are present on the postsynaptic neurons. The release of dopamine is controlled by calcium-mediated exocytosis. So when the action potential reaches to the presynaptic neurons, calcium can enter such that it can produce the exocytosis, resulting in the release of the dopamine. Now this dopamine can act on D3 receptors, which is inhibitory in nature, thereby reduce the cyclic AMP. Now when the cyclic AMP levels are reduced, it can stimulate the negative symptoms and depressive symptoms. So patients may perceive social withdrawal, flattening of emotions, bipolar mania. All these symptoms can be observed with increased activity of D3 receptors. Now Cariprazine is one of the atypical antipsychotic which can selectively block these D3 receptors. By blocking these receptors, it can reduce the negative symptoms as well as bipolar mania. In this way, Cariprazine can reduce the social withdrawal as well as it can reduce the flattening of emotional responses. So this may be the main action of Cariprazine, because among the atypical antipsychotics, this is one of the drug mainly blocks D3 receptors. Similarly, at the mesolimbic pathway, again dopaminergic neurons are present which are equipped with dopamine, and at the postsynaptic neurons, D2 receptors are present. Again, the release of dopamine is controlled by calcium-mediated exocytosis as well as 5-HT2A receptors expressed on presynaptic neurons. These neurons are inhibitory in nature, they inhibit the release of dopamine. Now, when the action potential reaches to the presynaptic neurons, calcium can enter to produce the exocytosis so that dopamine can release and it can act on D2 receptors. This again inhibits adenyl cyclase system, resulting in the decreased cyclic AMP levels, which stimulates the positive symptoms such as hallucinations and delusions within the psychotic patients. Now, cariprazine is one of the drug which can block these 5-HT2A receptors. Thereby, it can inhibit the release of excitatory neurotransmitters such as glutamate. And it can also block the D2 receptors, thereby can reduce the positive symptoms within the psychosis. In this way, cariprazine acts as antipsychotic as well as to treat bipolar mania. What are the precautions? One of the important precautions of cariprazine is that this drug can produce some delayed onset adverse reactions. Particularly, this drug can increase the extrapyramidal side effects after chronic use, and it can also produce some akathisia, restlessness. These are observed after a few months of treatment, which should be carefully monitored. And these side effects may be mainly attributed to the metabolites of cariprazine that are accumulated within the body. So, cariprazine can undergo dealkylation to produce des-methylcariprazine, which is simply known as DCAR. And another methyl group can be removed such that it can produce di-des-methylcariprazine. These metabolites can produce some delayed onset adverse reactions such as extrapyramidal side effects, resulting in the motor disturbances. So, care should be taken on chronic use of cariprazine, and any development of extrapyramidal side effects should be closely monitored. Similarly, this drug can precipitate neuroleptic malignant syndrome. This is common with many of the antipsychotics. So, it can produce few of the symptoms such as hyperthermia, the rise in the body temperature, some muscle rigidity, tachycardia, confusion. So, these symptoms can be developed by cariprazine, again on long-term use. Similarly, this drug can produce some orthostatic hypotension. This is because of block of alpha-1 receptors. Because of this side effect, it can produce syncope, some dizziness, tachycardia. So, again, care should be taken in those patients who are already having any hypotensive states. Similarly, this drug can produce some metabolic changes resulting in the increased weight. So, weight gain is one of the side effects that can be observed with the cariprazine. It can also increase the hyperglycemia. So, in the diabetic patients, this drug should be carefully given. In the elders, sometimes dementia may be developed, which results in the loss of memory. And this dementia may lead to induction of psychosis resulting in hallucinations, delusions. If in such patients, cariprazine is given, it can reduce the psychosis, but at the same time, it can produce cerebrovascular effects resulting in the increased risk of stroke and death in the patients. So, in the elders with dementia-induced psychosis, this drug should be carefully given. Similarly, this drug can produce some tardive dyskinesia resulting in the involuntary movements, and this side effect is particularly observed on chronic use of this drug. So, by stopping of this drug, we can control the tardive dyskinesia, but most of these involuntary movements are irreversible in nature. So, that's why this drug should not be used for chronic purpose. Only in few of the conditions where other options are not available, then this cariprazine should be used for chronic purpose. What are the side effects? The important side effects of this drug mainly include abdominal pain, dyspepsia, constipation, tachycardia, fatigue, arthralgia, joint pain, some back pain can be observed. It can also increase the agitation, insomnia, lack of sleep, some restlessness, and it can also increase the extrapyramidal side effects resulting in dyskinesia. Finally, it can produce some upper respiratory tract infections resulting in the cough. All these side effects are observed with this cariprazine. How it is given? This drug is available as capsules at a strength of 1.5 mg, 3 mg, 4.5 mg and 6 mg. The initial dose of the drug is given at a rate of 1.5 mg per day, and the maintenance dose depends on the type of clinical indication. For maintenance of schizophrenia, it is given at a dose of 1.5 mg to 6 mg per day. For management of bipolar mania, it is given at a dose strength of 3 mg to 6 mg per day. So that's about this drug cariprazine, which is an atypical antipsychotic which mainly blocks dopamine D3 receptors, resulting in atypical action, reducing the negative symptoms of psychosis, as well as it also reduces the bipolar mania. So this is a new generation atypical antipsychotic with less extrapyramidal side effects, but on chronic use, it can also precipitate the extrapyramidal side effects. So this drug should be carefully used when it is intended for long-term purpose. So that's about this drug cariprazine. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.